the scene is safe, you go phone 911, get the AED and the first aid kit. Do you have an EpiPen? Do you need help? I'm going to take the EpiPen, you take the cap off, you place it firmly in the thigh, halfway between the hip and the knee for about 10 seconds. You pull the EpiPen out after 10 seconds, straight out, and then you rub the thigh for about 10 seconds. After that, you give the EpiPen to the paramedics to dispose of properly. I'll be putting on the gloves. Now to properly remove gloves, with one hand, you pinch the cuff of the opposite hand, pulling it inside out and wadding it in the other hand. With the hand that you just pulled the glove off, you're going to take 2 fingers up under the inside of the glove, pulling that one inside out as well, turning it inside out so all contents are inside. After this, you'll place it in a biohazard bag. If you do not have a biohazard bag, you put it in a bag that can be sealed and dispose of properly. First thing you need to do when you come upon a scene where you need to control bleeding is first to assess the scene to make sure it's safe. I've checked the scene is safe. Next thing you need to do is get the AED and the first aid kit. I've already retrieved the first aid kit. Next thing you need to do is have the individual apply direct firm pressure to the bleeding area while you put on your gloves and phone 911. After I put my gloves on, I will also hold firm pressure to the bleeding area, trying to get the bleeding to stop. If the bleeding does not stop, you'll need to apply a tourniquet. Hold firm pressure. To apply a tourniquet, you can make your own if your first aid kit does not have one. You can take any cloth about 1 inch and wrap it about 2 inches above the cut. Tie 1 knot tight. Place pen or something long to where you can tighten the tourniquet. Tie the knot tight and use the long piece to turn it to make it even tighter to stop the bleeding. After this, you'll secure the piece in place so it doesn't come undone, and wait for paramedics to arrive. Are you choking? Do you need help? Because this individual is larger than I am, I will do chest thrusts. I take your fist and the other hand firmly over it on the lower half of the breastbone and give thrust until the object is clear. Pull straight back until the object is clear. If you notice someone larger than you choking, as I demonstrated in my video, or even a woman that is pregnant, the first thing you'll do is ask if they're choking. If they nod yes, then you ask if you can help. If they say yes once again, you will start by standing firmly behind them, placing one hand at their breastbone and the other hand on top, pushing straight back until you dislodge what is in the throat or until they become unresponsive. If someone begins choking, first off, they will most likely give you the choking sign. If you indicate this, you ask, "Are you choking?" If they nod yes, then you ask, "Can I help you?" If they respond by nodding their head yes to this, you can proceed to help them. First thing you will need to do is stand firmly behind them, placing one hand just above their belly button with your other hand placed over it, giving thrust straight back to dislodge whatever's in their throat. Give thrust until the object is removed. If you notice an infant that is choking, the first thing you'll need to do is lay them on your forearm, face down, providing support at the jawline for their head. You're going to take the heel of your hand and provide 5 back slaps on the heel of the infant's back to try and dislodge whatever's in their throat. If that does not work, you'll flip them back over and provide chest compressions with 2 fingers as you would for CPR for 5 compressions. If that doesn't work, you continue going back and forth between heel slaps and chest compressions until you dislodge whatever's in their throat. Usually infants choke on milk, food, their own spit up, and potentially even very, very small toys. I'm assessing the scene, and the scene is safe. Check responsiveness of a person by tapping on their shoulders and shouting, "Are you okay? Are you okay?" You phone 911, get the AED and the first aid kit. Next, you'll check for breathing. Check for about 5 to 10 seconds. If no breathing, start compressions for 30 compressions, allowing the chest to go down 2 inches in the middle of the chest. Allow the chest to recoil after each compression. Count out loud. 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Perform a head tilt, chin lift, and pinch the nose, and give 2 rescue breaths. You want to make sure the chest rises with each breath, and then return to compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 more rescue breaths. Head tilt, chin lift. Watch the chest rise. And the AED has arrived. Turn the AED on. Clothing and hair has been removed from the chest. Place pads on the chest. And clear the patient so the AED can analyze heart rhythm. Clear. The AED has indicated that the individual needs a shock. Everyone clear for the AED to shock. The AED has delivered its shock and you return the compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 more rescue breaths. Head tilt, chin lift. Watch the chest rise. And you'll continue this until paramedics arrive. When it comes to adult and child CPR, they're practically the same. Adult CPR, first you always start with checking the scene for safety. The next thing you'll do is check the individual for responsiveness by tapping their shoulders and shouting, "Are you okay? Are you okay?" The next thing you'll do is flag someone down to send for 911, get an AED, and the first aid kit. After that, you'll check for signs of life such as breathing. If you see no signs of life, you continue on to compressions. With compressions for children, you can use 1 hand or 2. With 1 hand, you place the heel of your hand in the center of the chest in the middle of the breastbone, pushing down hard about 1/3 down into the chest for 30 compressions for 100 to 120 compressions per minute. So after 30 compressions, you'll move on to 2 rescue breaths. When performing rescue breaths, you do a head tilt chin lift. By this, you'll place your hand on the forehead, providing the head tilt, and place 2 fingers on the bony part of their chin, providing the chin lift, and then you're pinching their nose with the hand that you have on their forehead to seal no air coming out. Provide 2 breaths while watching to see if the chest rises in between each breath. And you'll provide 2 of those and then return immediately back to compressions. If an AED arrives, you use it immediately. You start by turning it on and making sure all clothing is moved off the individual. Make sure they are out of water or any area with liquids. You make sure their chest is clear of water or liquids, and you make sure they don't have hair on their chest. After this, you place the pads, 1 up here and then 1 right down here. And then you clear the patient to allow the AED to analyze the heart rhythm of the individual. And if the AED analyzes and it indicates a shock needs to be provided, then you say clear again so no one is touching the individual, so the shock can be delivered. After the shock is delivered, you go immediately back to compressions and rescue breaths until paramedics arrive and further help arrives. For infant CPR, it is relatively similar to adult and child CPR. For infant CPR, the first thing to do is always check for scene safety. Next, you'll check responsiveness of the infant by tapping the bottoms of their feet and shouting, "Baby, baby." Next, if somebody is with you, you tell them to go get the AED, first aid kit, and phone 911. If you're alone and you have a phone, you call 911, put them on speaker, and continue on to check for breathing. However, if you are by yourself and have no cell phone, you go on to check for breathing, and if you hear no breathing after 5 to 10 seconds, you start compressions. With infants, for compressions, you take 2 fingers just below the nipple line in the center of their chest and press down 1/3 depth of their chest or 1.5 inches down for 30 compressions or 100 to 120 beats per minute. For this, you'll do 30 compressions and then move on to 2 rescue breaths. For infants, for rescue breath, you do a slight head tilt chin lift, meaning you still do the head tilt chin lift, just not as far back as you would with an adult or child. When providing rescue breaths for infants, you completely seal their nose and their mouth with your mouth to provide those breaths. Now, if the infant is older, closer to 1 year old, and your mouth doesn't fit around the nose and mouth, seal either the nose and provide breaths through the mouth, or seal the mouth and provide breaths through the nose. And then after the breaths, you return back to compressions. If you're alone, you can do 5 sets of compressions and 2 sets of rescue breaths. And after that, you take the infant with you to find a phone to call 911 and wait for paramedics to arrive. When looking at the chain of survival for pediatrics and adult, they differ within the first 3 steps when it comes to lay responders. For adults, the first link is assess the scene and phone 911. The second link is get to CPR quick and provide chest compressions. And the third link is use an AED immediately as it is accessible. When it comes to pediatrics, the first link is to prevent injury and illness in the first place. The second link is provide chest compressions as soon as possible. And the third link is call 911 after you provide chest compressions. So they differ in how when you call 911. The first one with adults is to call 911, when the third link for pediatrics is call 911.